Hello, good afternoon, everyone. Can anybody give me a thumbs up if you can hear me? Admitting a lot of people right now, so okay, good. I see some thumbs up. Thank you so much for joining us. My name is Lisa Blackwell. I'm the past president of T Sophie, and today our webinar. It looks like we have a lot of a very popular topic with everybody. Sorry, still having a lot of people entering. Um, Today we are partnering with It's Time Texas. And we have Ricardo, Amelia, and Andrea presenting for us. Um, and let me just introduce them real quick. Ricardo is Para is the program manager of the Community Challenge, which is a statewide wellness initiative where participants become health champions and log their healthy actions, which supports members of their communities in starting in their health journey. And he's been with It's Time Texas since 2022. He's a graduate of the University of Texas, Rio Grande Valley, and has a Master of Science in Exercise Science. And his work is focused on the effects of various resistance training methods in older populations. He's a native of the Rio Grande Valley, and Ricardo spends his free time in the gym, the kitchen, and going to coffee shop with friends. Me too, actually. I love it. And then we have Amelia Carnegie. Um, Amelia is the director of marketing at It's Time Texas, and she is dedicated to making a positive impact on the overall health of the state of Texas. Her master's degree is in public health, and her background is in higher ed education. She has an expertise in marketing, health communications, and graphic designs. She also has a passion for public health and is committed to driving behavior change and promoting healthier lifestyles. Her previous experience includes working at the Abilene-Taylor County Public Health Department in Abilene, Texas, and she addressed community needs and gained valuable experience there. She strives to create, pardon, to create impactful campaigns and initiatives that improve community health outcomes and empower individuals to make healthier choices. And then finally, I know a lot of you were here for our last It's Time Texas webinar where we met Andrea. um, Andrea Rosario is the Senior Director of Health and Civic Education for It's Time Texas. And they are the nonprofit creating a healthier Texas through a focus on health prevention. With more than 15 years of experience in public health, Andrea's work spans health curricula creation, program development, management, and advocacy. She oversees the development of community informed and evidence based health and civic education programs, ensuring their impact on Texas health in meaningful ways. She's also a social and reproductive justice advocate who serves on the board of Health Literacy Texas and Healing Hands Community Doula Project. And before I turn it over to them, I do want to point out that It's Time Texas has their Healthier Texas Summit coming up October 10th and 11th. And T. Sophie will be there. A lot of our board members will be there, and we're going to have a table. So it is in Austin, Texas, October 10th and 11th. So if you have enjoyed their previous webinar and this webinar, please join us all there. And now, without further ado, I will stop sharing my screen and turn it over to you.
Thank you. Give Amanda a few minutes to share. Go. So welcome everyone to today's webinar, The Power of Community Health Competitions. Just a few housekeeping rules. We'll have a Q&A at the end of the presentation, so please use the chat function to ask any questions during the presentation, and we'll make sure to answer as many questions as possible during that section of the webinar. Next slide. And this is just a reminder that It's Time Texas is funded by SNAP-Ed. Next slide. And so, of course, as Lisa mentioned, our presenters today are myself, Ricardo, and Amelia. Next slide. And It's Time Texas is a statewide nonprofit working to bring people, organizations, and communities together to take action and that supports health for all now and for generations to come. We believe where you live should not determine how long you live. That's why we're working to reduce the risk of preventable disease while increasing access to health for all Texans. At It's Time Texas, our direct service programs are designed to provide clear education and support Texans in creating and maintaining healthy habits. The Community Challenge is one of the ways in which we do this, and we are very excited to provide the TSOFI membership a glimpse of the various ways we've worked with communities to support them in improving health outcomes. Next slide. So today's webinar will focus on our three key objectives. First, we'll identify barriers to health and how they impact community health outcomes. We'll define gamification and explore how it can be integrated into community health competitions. And finally, we'll examine how the It's Time Texas Community Challenge supports communities in creating positive behavior change. Next slide, and the next slide. So as public health educators, we're all too familiar with the alarming statistics on chronic disease in Texas and the non-medical drivers of health that significantly impact our communities. These challenges, such as social economic disparities, environmental factors, and limited access to healthcare, are often compounded by personal barriers individuals face when trying to make lasting health behavior change. So common obstacles like lack of access to affordable healthcare, limited time, and resistance to lifestyle modifications can make it difficult for individuals to take the necessary steps forward to better their health. However, when we challenge communities to address these barriers collectively, we can transform them into opportunities for meaningful change. Community health competitions offer a powerful framework for bringing people together to tackle these challenges head on. By working towards shared health goals, participants not only improve their own well-being, but they're also creating lasting impact that resonate beyond the competition itself. These initiatives foster a sense of community, accountability, and support, which are crucial to overcoming the barriers to health behavior change. Community competitions offer a powerful framework for bringing people together to tackle these challenges. And so we work with participants not only to improve their own well-being, but also create lasting impacts that resonate beyond the competition itself. Next slide. So we know that the competitions, they're really powerful tools for igniting change. And one of the strengths of these competitions is their adaptability. Whether addressing obesity, physical activity, or chronic disease prevention, they can be tailored to meet the unique needs of any community, making them a flexible and effective approach to promoting healthier lifestyles and behaviors. This flexibility ensures that the competition is relevant and engaging, increasing the effectiveness and promoting healthier lifestyles and behaviors. Community competitions also create a very supportive environment where individuals feel empowered to make positive changes. By participating and connecting with neighbors and other community members, there's a wealth of shared knowledge, mutual encouragement, and a sense of accountability, all of which are crucial in sustaining long-term health behavior change. The competitive element adds to excitement and motivation, but it's the collaborative spirit that truly drives success, leading to lasting impact and that extends beyond the competition. Next slide. When it comes to enhancing or adapting health competitions, the format plays a pivotal role in its success. And so selecting the right format allows us to align the competition with specific needs, interests, and capacities of the community, where there are several effective formats that can be used. Each brings unique advantages. Some examples that I'm sharing on this slide are ideathons, which are described as fast-paced collaborative events where community members can come together to generate innovative solutions for pressing health issues. These events not only spark creativity, but they also foster a sense of urgency and focus, making them ideal for addressing specific challenges within a very short period of time. There's also crowdsourcing challenges where we take different approaches by actively engaging community in the problem solving process. So participants are invited to submit their ideas for health improvement with incentives or rewards, or just the sheer joy of adding to their community's health. Um, but this format not only taps into the diverse perspectives of talents within the community, but also fosters a sense of ownership and inclusivity as people see their ideas being considered and implemented. And lastly, there's community wellness challenges, which are designed to promote healthier lifestyles through friendly individual or team-based competition. And so whether it's a step count challenge or a healthy eating initiative, a fitness goal, these challenges motivate participants by turning personal health goals into a collective goal. The social support and camaraderie generated through these competitions can significantly boost participants' commitment in making lasting changes. The key to success to any of these formats is ensuring that the activities are engaging, they're enjoyable, and they're accessible to all participants. By making the competition fun and rewarding, we can encourage more people to get involved, sustain their participation over time, and ultimately drive meaningful health improvements. I'll pass it to my colleague Amelia to talk more about competition enhancements.
Thank you, Andrea. So I'm really excited to take enhancing competitions a step further. So we are going to talk a bit about innovation. Next slide, please. Gamification is a word that a lot of us have heard, especially recently, but simply put, it is the use of game design elements in non-game contexts. It was coined in 2002, rooted in behavioral psychology and game theory. Gamification elements, they enhance the efficacy of behavior change across various contexts by integrating game-like features into that habit formation. Next slide, please. So how can we apply gamification in public health? We can apply it within the trans-theoretical model. It is really a proven way to enhance successful behavior change by affecting self-awareness and empowerment. Gamified elements like progress tracking increase self-awareness and empower participants to take control of their journey. They enhance the effectiveness of that behavior modification. Other enhancements include engagement and community building, which is something that Andrea just touched on in a large way as well. I know that we have in our challenge some pieces that we'll talk about in more detail later, but points, badges, leaderboards, they drive consistent engagement while social competition fosters a sense of community, aiding collective progress. Now let's take a look at something a little bit more unexpected. Next slide, please. I doubt you were expecting us to talk about Pokemon Go today, but this was an app that was created for entertainment, and it was not created for health purposes. Yet there's been an extraordinary health benefit noted throughout users of the app. People who use this app have reported a 25% increase in physical activity over a period of 30 days. These are people who are not being reached by other means, by other health initiatives always. These are people who have been activated within a healthier behavior, lifestyle change here, that is actually very aligned with improving their day-to-day wellness while having fun playing Pokemon Go. Pokemon Go has opened the door, really showing us the potential of gamification elements as tools to influence behavior change. The tools within Pokemon Go, such as geolocation, social connection, they've demonstrated that gamified experiences can lead to substantial improvements in behavior, whether health-related, social, or otherwise. And it has really left us with the question of how can we design engaging tools that also improve health outcomes? So now I'm going to let Ricardo guide us on a little deeper dive through community health competition engagement.
Thank you, Emilia. Once again, good afternoon, everyone. My name is Ricardo Parra, the program manager of the Community Challenge here with It's 10 Texas. The Community Challenge, as you'll learn on the next slide, it's a statewide effort designed to promote healthier living while fostering community engagement. The Community Challenge is an opportunity for us to come together and improve our community's health outcomes. And so you'll see that the Community Challenge is a free 8-week health competition designed to promote daily health habits while bringing communities together to achieve shared wellness goals. It fosters a sense of unity and accountability, encouraging participants to stay committed to their health priorities. By adding an element of friendly competition, the challenge creates a fun and a supportive environment for lasting positive change. And I think what's really important about the community challenge is the partnerships that we've been able to cultivate over the last few years. You'll see on the next slide, partnerships are crucial in the community challenge because they amplify the impact, by bringing together diverse resources, expertise, and networks. When local organizations, businesses, and leaders collaborate, they can reach more participants, provide stronger support systems, and offer incentives that keep people motivated, right? Partnerships also help build a sense of shared responsibility for the community's health, ensuring that the challenge has lasting benefits and continues to inspire positive change long after the community challenge ends. And then on the next slide, we'll learn some examples of successful partnerships. We have to give a shout out to the City of FAR. They have won the last 4 community challenges in their size category. And their success is largely due to employee wellness initiatives, health fairs, and employee rec leagues. It's really fun. Anytime we're in the City of FAR, we get all these anecdotes from the employees on the ground, just of how much of a positive experience the community challenge has been for them. So it's always fun to be in FAR and to hear those great stories from them. Similarly, PSJA ISD, FAR San Juan Alamo ISD, they involve their staff and families, the staff, the families, and the students and families by offering weekly initiatives, walks, health fairs, and other events on campus or at the neighboring parks, to get people out, to get people healthier, and to build that community. And then last but not least, San Antonio and everyone at the San Antonio Mayor's Fitness Council, they've been huge supporters of ours. Volunteers will coordinate weekly walks at parks throughout the city, trying to overcome that barrier of not being able to access these certain things. So it's really great that they spread out and they covered the entire city and giving everybody an opportunity to participate. I think I'll hand it back off to Amelia. She'll take us through the next slide. Oh no, this is my slide. I'm sorry, y'all. And so I think what's really special about the community challenge is that we give those communities the tools that they need and they see how best fit it is for them. We let them take the reins by building trust and relationships. We'll empower the local champions by having them design or decide what healthy or what the priorities are for their communities. Creating accessible opportunities. I think that one in particular, where we talk about not quantifying the health challenges within the community challenge app. What's more important is the fact that you're being physically active rather than completing 10,000 steps in a given day. I think ultimately the act of being healthier or being physically active, it's what's celebrated here or rewarded here. We do like to keep open communications with our partners by hosting weekly webinars, or we'll assign different special partners dependent on the communities. For the Valley, I'm in the Rio Grande Valley, so a lot of my partners are down here, whereas Amelia in Abilene, she's helping cultivate community challenge partners up in Abilene. And I think that goes back to leveraging the local resources. We know what's best for our community, so we let the local leaders, the local stakeholders take control. And then lastly, celebrating the successes. We love to have these award ceremonies at the end of the community challenge, and we encourage those communities, whether or not they placed in the top for their categories, to celebrate the successes, because ultimately this is a lifelong journey and we don't expect it to end after 8 weeks. However far you came in those 8 weeks, we got to celebrate those wins. And then now I can hand it off to Amelia.
Thank you, Ricardo. So enhancements beyond just within the gamification space that I was speaking to a second ago, definitely leveraging our partners and working within communities is important. And one thing that we really enjoy within the community challenge here is hearing what they have to say and making improvements within the app to address their needs. And so on an annual basis, I don't know if it's been mentioned yet, this is our upcoming challenges, our 13th annual community challenge. So something to celebrate internally for us. We have made improvements over the years. Some of those are featured here. So we have noted some areas of improvement over the past few years, especially implementing gamifying elements. So we have map features and group activities. These are two really great features because they allow for us to activate not only participants within communities, but existing resources in communities themselves, and allow those participants within those communities to see it's not just these 8 weeks. You can be activated, you can be active, you can prioritize that wellness throughout these resources, using these resources beyond the challenge. So these two features are wonderful in that way. They also encourage social support in a really great way. So within the social support features that we have groups coming together and having a hosted Zumba class in the park. We're having people who come together in community centers where they haven't before. And this is just a really exciting way for us to see our map feature, our group activities feature, get people out of their comfort zone and trying new resources. Beyond that, we also have badges and high fives, which I am pretty happy about the badges. You can see them here. And you can also see the quote that we have from our post survey. Earning badges and weekly challenges made it more fun and kept me working towards my goals. That's what we want to do. We want to motivate and encourage people every step of the way. So badges, they're rewarding and reinforcing those healthy habits every step of the way through the challenge. And then our high fives, that is something where we're motivating within the community itself and encouraging one another through just a simple high five, just as simple as putting an emoji in the chat here in Zoom, just giving that little bit of, I see you, you're doing great, reinforcing that positive behavior, reinforcing every step of the way and making everyone feel like they're on this journey together. So these are just a few of our gamification elements that we found really useful within the challenge. We have a few others as well, but for time's sake, we'll leave it to these 4 today. Next slide, please. So some key strategies beyond those different elements within the app. We have some pretty stellar communication strategy that really supports every piece of the challenge. We have a lot of different platforms and a lot of channels that we're sending this communication through. We have blogs, we have weekly newsletters with education and newsletters tailored depending on what the participants' involvement really in the challenges, whether they are an individual participating, someone who has taken our Health Champion Pledge, or even someone who is a partner and would like some encouragement and guidance on how best to activate their community. So we have tailored messaging and it's consistent, clear messaging. It's very important that within our communication strategies, we keep a few things in mind. I know this is a lot on this slide, so I'll try and keep it a little succinct here. Clear and consistent messaging through the multiple channels. It really has kept participant goals aligned, so they are provided timely reminders and support and education that really reinforces where they are and that commitment they have to the challenge. We're sending this on a regular basis through different channels and aligning that education across these channels. So if they'd rather watch a video, they can watch a video. If they'd rather read an email, they can read an email or a blog. They have information at their fingertips, accessible in the way that they best would require that information. Also ensuring that this content is dynamic. So, like I said, videos. We've had some really great videos done by Ricardo. I'm going to give him a little shout out here that just really puts someone there supporting them and cheering them along. We've done videos and, like I said, blogs that really give that extra level of engagement and encouragement through the different challenges and barriers that people come across when trying to form new healthy habits. Encouraging messaging, kind of to segue off of that, we really want to make sure that our messaging is positive and uplifting. So if they're having a hard week, it might be as simple as an encouraging email keeps them on track. We also want to make sure, though, through our messaging that we're promoting a friendly competition, because as soon as there's a negative rivalry, then they might get off track. They might not want to stay the course. So friendly competition really drives that engagement. It's about making competition an enjoyable and shared experience. So it's working together towards those goals, building a healthier Texas together. And then finally, the last piece for communication that I really want to touch on is reactive communication, because acknowledgement matters. When we highlight participants' contributions or share their tips, it's not only that it makes those individuals feel valued, but it also fosters a stronger sense of community. In addition to that, we're also sharing stories. We're going out there and hearing what they're doing, hearing their successes. They may not be the top person on our leaderboard, but they may be the person who's encouraged the most people in their community. We want to know that story, and we want to share that story across all of our channels. It's those pieces that really engage our community audience, and that's what really drives people to stay the course with the app, to stay the course through the entire competition. So I would love for Andrea now to touch on some of the successes, some of our numbers from 2024.
Yes, thank you. So yeah, let's take a little bit of a closer look at some of the remarkable outcomes of the 2024 Community Challenge. And so this year, we saw an incredible level of participation with 357 communities coming together to make a difference. Within these communities, over 4,800 individuals stepped up as health champions, each taking pledges to lead healthier lives and inspire others to do the same. The results of their commitment were nothing short of inspiring. And over the course of the challenge, participants reported eating more than 79,000 healthy meals, and over 11,000 group activities were logged. These activities not only helped improve individual health, but also strengthen bonds within the communities, showing how working together can make healthy living more enjoyable and sustainable. I would say even more impressive is the 151,554 healthy actions that were reported across the participating communities. These actions range from small daily choices to larger lifestyle changes, so each contributing to the broader goal of improving community health. The sheer number of the reported points and actions underscores the power of community health competitions to really mobilize individuals and create a ripple effect of positive change. These numbers, they're more than just statistics. They're a testament to the collective impact of our efforts. They illustrate how and when we unite in a common goal and in a common health goal, we can drive meaningful and lasting improvements in our well-being. Next slide. Next slide. So to wrap up today's webinar, we are wanting to share some of the key takeaways that we would like to highlight. And so first, integrating badges and a focus on goal attainment can significantly enhance the participant experience. While traditional leaderboards and point systems can drive engagement, we may not always capture the full scope of an individual's progress. So badges, on the other hand, offer a more personalized approach by recognizing specific achievements and milestones. This method not only acknowledges participants' efforts, but also motivates them to set and pursue meaningful health goals. By shifting the focus from merely accumulating points to achieving personal and collective goals, we create a more rewarding and encouraging environment for all participants. Second, building strong community partnerships is essential for boosting excitement and participation. So collaborating with local organizations, businesses, and stakeholders to help expand the reach of the competition, and it fosters a sense of community ownership. These partnerships can provide valuable resources, support, and visibility, making the competition more appealing and accessible to a wider audience. Engaged community partners can also amplify the impact of the competition by offering additional incentives, hosting events, and promoting the initiative through their networks. But ultimately, our goal is to create environments where every participant feels motivated and supported throughout their health journey. And so prioritizing personalized recognition, fostering community connections, and ensuring that every individual feels valued and encouraged, we can drive engagement and foster long-term health improvements. I'll pass it to Ricardo.
Thank you, Andrea. And so everybody attending the webinar, thanks y'all for joining us. If you're up for taking the challenge and catalyzing the power in community or in your community to build a healthier Texas, scan the QR code, register to receive community challenge updates. We're really excited for what's in store for this year's community challenge, and we hope you can join us.
Next slide.
Awesome. I saw a few questions in the chat. Sorry. The first one was, what platform is used for the community challenges?
So we actually have an app that we use through Sunshine Points, and that is tailored to the specific needs of our challenge. But there are, if you'd like more information about that, we're happy to share. So reach out to us. But there are a lot of opportunities, I feel like, within apps. And I do want to just specify, I know that we're talking a lot about technology within the different pieces we spoke on today. Innovation can be something that doesn't rely on a smartphone or an electronic device. Even the gamification, it can be as simple as an activity tracker that you hang on your refrigerator. So if you're looking at scalability of this and see an app, I don't think that I have the ability to implement an app this year for a challenge, but I really want to do a challenge. Don't feel disheartened, because at this point, we are at the point where we have the app. But in past years, we've done things much different. And so we've grown to the point where we have this app. I do want to just reiterate that, though, that it can be as simple as an activity tracker that someone is coloring in on their fridge, or as complex as an app. Oh, I'm so sorry. You are muted.
Sorry about that. Yeah, there was a similar question about engaging community members that have low technology literacy or don't have a smartphone app. So you mentioned the coloring trackers. Do you have other ideas or suggestions?
Yes, absolutely. So we actually, in addition to doing something like a paper model or a coloring tracker, doing something within a space. So if you're in a community environment, say, I'm thinking scalability here. If you're within a school and you're wanting teachers to be in a challenge for health and wellness, even something as simple as putting a banner up in the teacher's break room where you're attaching something that counts as like points or like actionable tracking, can be something that's visible and gives them that bit of a positive reinforcement. I'm thinking, if you're in a space like that, if you aren't given that opportunity, if you're working with a community and you have people within the community who don't necessarily have access, I would go back to something that's more paper pencil, something like a handout, an activity sheet of some sort, just because that is attainable by most everyone. Outside of those two, though, I don't know.
Yeah,
Top of my
that's
head.
really helpful. Thank you. How long do you usually, how long does the development process usually take with technology
Ricardo, do you want to take
to
this one?
implement?
Yeah, sure. So we have a great partnership with Sunshine Points, who, where we have weekly, discovery sessions, any updates that need to be required or any challenges that participants have identified. We try to resolve these issues immediately. So we're always working together with the app the entire before, during, and after the challenge. I believe we've been in partnership. We've had the app for about 3 or 4 years now. Whereas before, we did have different methods. We used the website, but I feel like right now we're at a good place with our app, and yeah, I hope that answers the question.
Yeah, I think that would be helpful. Thank you. And then we had some questions about how you communicate and publicize this. Like, do you publicize in schools? Do you use public radio, communications?
We do a bit of all of the different platforms. Since we do have such a wide audience, being The state of Texas. It is kind of wild to think just one direction. So we do advertise through radio channels. Currently, we actually have some ads running for podcasts as well as digital streaming radio stations. We have done radio spots, little talking segments in local stations across the state as well. We have had ads even in malls. So we have kind of spanned the whole breadth there. I do know that one piece that we have had really great partnerships in, which kind of touches on the publicizing in schools, is we have so many wonderful partners in schools that is a huge way that we are getting into communities to tell them our story and to tell them about the community challenge.
Yeah, that's awesome. I bet kids get excited and then like go home and tell their parents too. That's awesome. I see Juan Carlos had a question. Do you have bilingual challenges? I think you have bilingual people on your staff. Yeah.
Yes, we do. Our challenge
Sorry.
is offered bilingual, so even the app is offered in English and Spanish.
Yeah, perfect. Wonderful. And then let's see, Katie asked, have you moderated competition that has not been positive? I mean, because you mentioned fostering positive experiences in competitions. I
I
don't know if
think
you have
just
an
in
example of that.
general, yes, I think just in general, the competition space is easily one that becomes a little bit more rivalry negative. So we have just made a pretty strong effort, and especially as we're moving into this year, we're even having this conversation now as how do we make sure everything that we're putting out is encouraging that motivation, encouraging that community to foster a positive experience, and really building our messaging around do your part to help your neighbor, neighbors helping neighbors, people supporting each other, communities getting healthy together, really working on the messaging to be in that line of thinking. We have had some not as positive experiences in the past, and I know we've addressed in that similar way where we are tailoring messaging to provide that encouragement and motivation to hopefully offset that rivalry piece. And then just being cognizant of that as we're doing our planning for continued communications for the current challenge or future communications.
Oh yeah, thank you so much. So good at answering these. And we had a final question, unless we get any more, about do you utilize health metrics to assess participants before the competition? And also they said great presentation.
I got this one. Finally, I'm like, yeah, I get this.
The data
So we do-
question.
I know, right? But we do have a pre-survey and a post-survey where we'll measure outcomes such as health literacy. So the importance of including fruits and vegetables, the importance of regular water consumption, or their knowledge around the amount of exercise time that's recommended. But then we also ask questions around how much they're actually consuming around fruits and vegetables, hydration, and physical activity. As you know, with pre and post tests, especially with competitions this large, it can be somewhat challenging to get the same amount of post tests or pre-tests or post tests as we do pre-tests. So to show how much impact we want will still take a little bit of time over the course of a few years, of course, but we do see difference in pre and post tests, significant sometimes change where we'll see so for vegetable consumption pre-test, we'll see around 42% of people reporting consuming anywhere from 5 to 7 days a week, where post-test we'll see an increase where it says 69%. Those are actual numbers. So yes, so we do have our outcomes measures that we do see pre and post-test.
I love that. And then you guys have so many different programs. So like once they're in, there's all kinds of areas that they can go from there.
Yeah,
And that
absolutely.
kind of
And I
brings
think,
me, sorry, Katie's question
oh,
was, what's a follow-up like for long-term change? So let you answer it.
yeah, even perfect. So it is, we do use Community Challenge as kind of a funnel into our other programming. They have this piece, they're seeing themselves create that behavior change. How do they maintain it now? And so we see that in them participating in our telehealth coaching and our virtual physical activity and nutrition classes. And we see that in some of our other programs where organizations are seeing significant impacts, positive impacts. So we're able to support them in creating school health improvement plans. So how do they keep maintaining that? And then even through our school health advisory council webinars to learn more about how they can improve health and wellness in their communities. And so we do see a level of continued participation at the individual and organization level when they participate in Community Challenge.
Okay. All right. And then she also asked if there are any reflection opportunities for participants around their engagement. If that's something that you do with your follow-ups.
We do include some of the quotes actually in our presentation are from our follow-up where they were able to reflect on both how the actual competition as well as features within the competition assisted them in being successful or maybe not successful in their own goal setting or in their own behavior changes. So we actually have had some opportunity there, but then also we do ask on social media in a lot of our outreach for feedback and for people to share their stories. And as soon as one person starts sharing their story, we usually have that inspiration and encouragement for others who then jump on and start sharing their stories as well, and just encouraging each other. So throughout the challenge, our goal is for people on a weekly basis while they're having a different topic each week, then coming back at the end of that week and really being able to reflect, as you would say, Ricardo, a weekly rewind. And so y'all haven't been a part before. We do have these moments built into our communication as well.
Awesome. That's wonderful. Thank you all so much for being here. Do you guys have any parting words for us? Oh, I see screen sharing. Oh, okay. Oh, great.
Yes.
Contact info.
Yes, we'd love to say thank you for joining us. And we hope that this webinar has been very informative and supports your efforts in learning about the impact of community health competitions. If you'd like to dig a little bit deeper into gamification and our team's insights around community health competitions, follow us on LinkedIn, where we'll be sharing an article on these aspects and more. And please visit our website to learn more about our other programs and connect with us on social media. And lastly, we'd appreciate you completing our survey to share any feedback about today's webinar. And we'll link the survey in the chat, and it'll also be in your follow-up email. So thank you so much for allowing us into your space, TSOPHE and members, to learn a little bit more about It's Time Texas work. Thank you.
Thank you. Thank you so much for being here. I just want to let everybody know our next webinar will be September 17th for National Voter Registration Day. We're hosting Healthy Democracy, Healthy People, and they're going to talk to us about the importance of civic and voter participation to create healthy communities. So, and don't forget to check out itstimetexas.org for more information about their great work. Thank you guys all so much. Happy Tuesday. Thank you. Bye.